Next up, please welcome CEO Kaiser Permanente, Greg Adams, in a conversation with co-founder and CEO ARCHANGELS, Alexandra Drane.
I'm so relieved right now. Oh my God.
Yeah.
Let me just.
So, Greg, you are one of the most impressive leaders I've ever met. I think you lead with bravery and with authenticity and with heart, and I've witnessed firsthand how much you get done. We've got 20 minutes and a lot to cover, so I'm going to ask you guys to buckle up because we are going to move fast. So, Kaiser Permanente started in the Kaiser shipyards in 1945. Women and men and people from historically marginalized populations worked together equally. And during the time of segregation, KP refused to separate black and white patients and was one of the very first healthcare providers in the US to have racially integrated hospitals and waiting rooms. So health equity is clearly in your bones. And I have to imagine at times this early effort wasn't always universally well received. Have there been times when that commitment has wavered over the years?
One, great to be here, great to see all of you, trying to see you. No, I don't think there has. I think this is an amazing organization. Its commitment to equity, its commitment to diversity is why I'm a part of the organization. There's a story that in 1946, a year after our health plan became public, that I love to tell. One of our leaders was touring a couple of police officers through, and they were trying to make the decision about whether or not they would become a member of the health plan. And one of the officers said, well, gee, it's kind of a problem. We see black and white people in the same room. And the response from our leader was, we work together in the shipyards, we get sick together, we receive care together. This is who we are. If you don't, that doesn't work for you, then you really should choose another health plan. So it's been who we are. In 2007, our board took the position that we would own and we would lead the nation in eliminating health disparities. And so from 2007 on, we've been on a 15-year journey. And if you look today, whether it's hypertension, whether it's cancer, you look at where we are with African Americans, with Asian Americans, with Latinx, I mean, we've closed the care gap. And so it's just a part of who we are. It's in our
Two
DNA.
quick stats from you on those two, if you'll give me them. I'm curious on the hypertension.
Yeah, so hypertension, if we look at where we are in comparison to the nation, we're probably, I think, like 30% better. For African Americans, we're 47% better. If you look at cancer care, our cancer care, if you are in a community, and Kaiser Permanente is in that community, and you have Kaiser Permanente, you're 20% less likely to die from premature death from cancer. So it's just a part of who we are. If you're an African American, I think the percentages go up to like 33%.
Yeah, so I love that. I love that impact. And also the reminder you just said, it's been 15 years from that commitment to seeing the sustainable change. And I think we have to leave space really for this longer view. So I love the quote, no human steps in the same river twice. It's not the same river and they're not the same human. And this sense of never-ending pace of change has always been true, but maybe never as fast a pace or as true as it is right now as of COVID. Tell me, I love this notion of the 1945 Kaiser shipyard members. What would you say is the modern day equivalent of that? How is that historical commitment really reflected in what you've done in these last 3 years to address health equity specifically?
Yeah. Well, the last 3 years have been dramatic for us, as it has been for all of you. At the beginning of COVID, we saw the disparities in care. I mean, we saw and we know that African Americans, Latinx, Asian Americans, chance of dying twice the rate of white Americans. And we saw the social unrest, the fractures that were evident in our society. And one of the great push and moves with our history, for internal and external, was for us to step up, to do something, to be a voice. And it was tough because We wanted to, and yet I recognized that there was something different. And so I actually took the organization on a listening tour prior to kind of stepping out and taking action.
So I want to go there because I love that notion that you are inherently an impatient person. Like you want to go, go, go. But you did draw yourself back and say, hold up. It's a turning point for our country. And so you did kick off this listening session. Tell us, go behind the scenes. For you personally, what did you hear? How did it change you? What was the effect?
Well, the session, it was myself, our HR leader, our leader of diversity. We met with employees and business resource groups over a period of many weeks. And it was really, it was life-changing for me as an individual and as a leader. Rich history of diversity, and yet I heard within our organization of stories of racism, oppression, systemic racism, and I heard people tell stories of what they were experiencing external to the organization. A week before my meeting with one of our Asian American female employees, she told me of being in a store, a retail store, and she and her 2 daughters being pepper sprayed.
Yeah.
Stories of an African American female who had, the microaggression of someone touching her hair. The story of a Latina who was formal charge was raised against her for how she spoke and her pronunciation. But there are also stories of white individuals in our organization who also felt that they were being oppressed by either individuals or other groups in the organization. So I kind of came to a place of realizing that we were all at different places and we'd all traveled different paths to get to the moment, and how we led and how we understood and how we dealt with the moment was going to be important for the organization and for all the people that I'd spoken to.
So I love this notion that, really recognizing that we're all starting from a different place. So you yourself, you grew up in Georgia, you experienced inequality, discrimination. As a rising leader, a colleague once refused to shake your hand because you're black. So if you don't mind, share with everyone here what I've heard you share with your own teams on this notion of, I would consider you like chest out to the tape, right? Back to this like eagerness, just go, go, go. How are you using what you yourself have experienced to drive this change?
Well, I think as leaders, we can't separate how we lead from who we are. And I think that's so important for me and for others today. And so, I had the benefit of growing up with 2 amazing parents in the South who I think for much of their adult life felt and experienced racism and oppression. And they brought that home and it was discussed. And it was clear, it was a sacred truth in our home that if you had experienced and you understood, then you had an obligation to be a voice, to amplify the voice of others, and to in no way oppress or participate in that. So this sense that regardless of who we are, we have an obligation for everyone in creating, a society and a culture and a democracy and organizations that are multicultural, multiracial, that we're all included in.
Yeah, I love this idea, the idea of a sacred obligation to create equity for everyone. It also strikes me as a broader goal, maybe, than what a lot of organizations are talking about. So can you say more to this audience? What do you say with your employees as you are describing this commitment? How would you explain it to community more broadly?
Yeah, well, for us, and what, this isn't always popular, and we've been on a learning journey, and we'll maybe talk a little bit more about that. But for us, it is, as individuals, we bring these amazing, authentic selves to work. We bring our identity, we bring our race, we bring our culture, but we are about being one Kaiser Permanente. And I think as a democracy and a society, we're about being one humankind. And that means that we don't step over or we don't ignore what's played out in terms of systemic racism, what's played out in terms of what we saw during the pandemic, what we see even today. But it does mean that we move our organizations and our country and our society toward this humankind, this oneness that I think is really all about humanity.
Yeah, you said during one of our calls, coming together on the things that make us different, which I think is beautiful. So you're working to address this massive challenge, recognizing the humongous opportunity that it represents for our nation. I think sometimes organizations in going after big challenges face, analysis paralysis. And you could even have team members who are more focused on admiring the problem than driving what you're learning into action. So you have a bold plan that you've been developing. How are you translating everything you're learning, everything you're feeling, listening with your whole body? How are you translating that into action?
Yeah. Well, we're a very action-oriented organization. I'm a very action-oriented leader, and we measure. So it's a part of who we are. But when we stood in front of the organization and said we'd been on a listening session and we wanted to now talk about what we were going to do, we identified a number of things that we were going to do, and we're moving those things forward. One was that we would, or that we actually developed equity principles for our organization. It's where we've defined, if you're in Kaiser Permanente, and as we're on this mission of being more equitable and being more multicultural, these are the guardrails for that. And we expect every employee and every physician to kind of operate within those guardrails. And we've let people go if they're not able. Just as the person said to the policeman, this is who we are, and if you don't want to be a part of the health plan, that's your choice. This is who we are in terms of our commitment to being multicultural, our commitment to being an equitable organization, and it's a journey we're on. If people want to be a part of it, then they really must kind of embrace those principles, for example.
So I think there's really a bravery, right, required on the part of an employee to actually speak their truth, to be their authentic self. So I was part of a DEI roundtable recently where a woman spoke up, and I'm going to quote her exactly. She said, "We're told by our C-suite to bring our authentic selves to work. But it's like they forget the second half of the sentence, which would be, so long as your authentic self is what we want it to be." So quickly run through evidence you're seeing that this training is enabling.
So one of the things we did, which I didn't really say, is our leadership team went through training, an anti-racism training, and I think 5 times we kept changing it until we got it right. And there are 2 components to it. One is really understanding bias within ourselves, bias within our communities, and understanding how to be a voice. The second is really understanding our history, 400 years, systemic racism. But we worked with the Winners Group, we worked with PolicyLink as we kept coming and going, and we wanted it to truly be inclusive and to tell the story of Mexican Americans, Chinese Americans, to tell the story of the cultural issues. So we wrote that so that it's all there. Our employees are going through it. 100,000 employees have gone through this program. 91% of them say that they engage with their colleagues differently. Our speak up scores are kind of going through the roof. But most importantly are the stories that I get. And I received an email from an employee, an African-American employee, who talked about coming to the organization because of what she had heard about our values and how she understood the organization, but in being in the organization, experiencing something different, and how that moved her to a different place, and basically one of being depressed and maybe thinking about leaving. And as she engaged in the program, and as she heard me say that this is who we are, be here with us, or if you can't be in this space, then it's okay to choose somewhere else, that she had chosen to kind of be the person, to be her authentic self at work, and that the organization was embracing her as she was doing that.
I love that. So I'm going to look at the time, and we're going to start moving rapid fire because that clock has got a mind of its own. So I think there's a feeling with people sometimes that companies hang this sign out, but they don't take the actions to actually do what it would take to live that all the way through. tell me quickly some examples of ways that you are showing this is not just lip service.
Yeah, well, we mentioned the training and the number of people that have gone through, and it is voluntary, by the way. But then there are a number of things that we're doing that I think are so important. And I'll just list a few looking at the clock. One we have an accelerated or leadership development program that I'm most proud of. This year we admitted the class into the program in a mask model interviewing process. So they were accepted not knowing whether they're male, female, their gender, their ethnicity, and the outcome of that was amazing in terms of the change in the numbers and the diversity. We have our equity principles, which we lead with and we make decisions with. And we've made some tough decisions that we can't get into because we don't have time. We actually went through a process of looking at all of our job families, making them more simple, and then assess them in terms of pay based upon race, ethnicity, gender, and made changes. And that is kind of an annual process that's underway now. I mentioned the equity scorecard. We've always believed that our workforce, our physician, our employees should be representative of the communities that they serve. We have scorecards that are in place for every market where we measure that, and leaders and managers, their pay, their incentives are based upon their compliance or their movement and their improvement. And I could go on, but I'll stop there. And I do want to say, as I mentioned to you, just in preparing for this, I was like, wow, we've kind of done a lot in 3 years, in addition to managing COVID and all the things that we've done. But it's really our employees and our leaders that have stepped up to make this happen.
Yeah, no, and so a couple more quick questions. One, this concept of a diverse workforce really resulting in more personalized and culturally sensitive care. Pull that one more step for me, which is how are you seeing that actually play out in outcomes that reflect that commitment to health equity?
Yeah, when we went through the process and we actually developed an enterprise plan in the middle of COVID. So our plan reflects a lot of our kind of addressing what we were experiencing. So one of the things that the board did, because it was what should the board do during this, was to shift our quality outcomes, all of our quality program to outcomes. And so our program now is all about outcomes, and the board asked that we look at outcomes through the race of ethnicity and gender, and so that process is underway. And when you look at those outcomes, I mentioned earlier that you will see that we have a significant difference in terms of a number of clinical conditions. I mentioned cardiovascular, I mentioned cancer, and actually when we go to the board in December, we will have a kind of a comprehensive scorecard that we will continue to measure and continue to assess.
So I had mentioned to you that we have done this work in Ward 7, not related to Kaiser. And as you see that data play out into an individual level, like a woman who might live in Ward 7, and we heard this one woman tell her story after everyone else had told heartbreaking stories about not being able to get access to care, not being able to get help with navigation, the fact that she had. One of the things that you talk about is the integrated nature of social health, community health, and the data that supports it. Can you tell me quickly about that?
In the middle of the pandemic, enterprise plan, we decided that our care model and our plan of care for all patients should incorporate social health. Yeah. Short story, we are on plan to bring 2 million members' social assessments into our clinical records. We've got a Thrive system that connects all of them to social resources in the community. It is a beautiful thing to see, and it changes the way people experience care and the way they're connected to resources, food, health, whatever those resources are in the community.
Right, and that story that I heard from that woman was about this broader definition of what it meant for her. So we're gonna bring this home. This is our last question. This is my favorite. So in one of our prep calls, I asked your team, I was like, what makes Greg mad? What frustrates him? When does he get cranky? And my team could answer very quickly, my face gets, I'm like, how do you know he's mad? My team will be like, well, you get short and fast and loud. And they said something so gorgeous. They said, you know things are about to get serious when he starts a conversation with, "You're going to have to love me through this." And I think that so perfectly reflects one of the things that's really stood out to me, right? Which is you are really about collaborating through and with and from a place of love, of real love. So I'm going to end this conversation by asking you, tell this room, tell each of us, tell the industry, the nation, really more broadly, what are all of us going to have to love you through?
It's love me through the truth. I think there are two things that I would leave you with. Is one, the conversation around multiculturalism and where we need to go as healthcare and where we need to go as a nation. We just concluded the elections. We're a divided nation. We need a new story. We need a new narrative. And I think it is in honoring and owning and understanding the years of systemic racism, understanding the black and brown experience, but also understanding that our future is about us being together, valuing those differences, but it's about us. And how do we make sure that the inclusiveness includes us? So that's one. The second one, we're out of time. The second one is, I struggle with the fact that we've gone through the worst pandemic that we've ever seen in modern lifetime. And we got through it and we held our health system together, but it did not work well. There were major fractures that we saw. And for a lot of reasons, we're not talking about that. We're not talking about our financing system. We're not talking about the lack of funding for our public health system. And we've got to get there. And from Kaiser Permanente's perspective, we're committed to being a voice and being a leader. But I heard earlier that there is the ability and the power in this room to change the world. And I think we, the people that are here, have got to own that opportunity and lift our voices so that every voice is engaged in both of those conversations.
Yeah, well, I am so grateful to Health for the great honor of this stage, the impact this audience can have, and for my being able to have this role with you. Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you, guys.